Hi everyone, it's Joni again. I remember what I plan to do today, and so I am going to talk about mental illness and medications and your psych eval and how things like that will affect your ability to get weight loss surgery. The other thing that I wanted to share first is that last night I got on the scales and I was 102 pounds down. So my first major goal of losing over 100 pounds, woohoo, I've done it. So basically 5 months. I had my surgery done on August the 1st. Today is January the 3rd. So, that being said, as far as the mental health thing goes, there's a few sides to it. The first one I want to talk about is, can you get approved if you have mental health issues? The answer is yes, but it depends. You have to go through, some people go through this really long psych eval. I know mine was like hundreds of questions, like 2 different types of papers. There were hundreds of questions. And so many of them asked, like, do you feel like alcohol or drugs is a problem in your life? Have you felt suicidal? Do you feel happy with life? I mean, they ask those kinds of questions repetitively. And for mine, because I have a history of mental illness, I have attention deficit disorder, which really doesn't affect gastric bypass surgery, which I no longer take medicine for, which is probably why sometimes I may seem a little scattered on my videos. But I also have suffered from major depression, and I had what they call suicidal ideations, which meant when they took me off the medicine for ADD, they also took me off of the medicine I was on for depression at the same time. And they took me off really fast because I was having seizures, and they thought that might, even though I'd been on them for ages, that it might, make me more prone to having seizures. So they took me off those things very rapidly, and within 3 weeks' time, I felt really odd, really low, really strange, and I ended up being hospitalized because I wanted to kill myself. You take somebody off their antidepressants that was stable, that might be what you get. So they straightened out my medicine, and I was able to come home in a short period of time, get me back on my medicine. But I have been hospitalized 2 more times for the same thing over the years. I will say that my last hospitalization was 2 or 3 years ago, maybe. And that's one of the things they take into account. My testing, I answered everything honestly, and my testing showed like I had a really high potential for that problem, like, that I, could have, suicidal problems. And so, and in the hospital at the time, and I don't know what criteria they used, but they diagnosed me with bipolar disorder. And I'm a nurse. I don't really know that that's completely true, but I do see some of those behaviors, so I'll own it. I'm medicated. I take several different medicines for my mental health, and it's not a character flaw. It's a chemical imbalance. Just like if your pancreas isn't working to produce insulin and you're diabetic, something in your brain isn't working quite right, then you have to take medicine or stop doing something or whatever these things are to balance it out. In my case, it involves taking medicine. So what I had to do after I took this test is I had to have the doctor that followed my psych meds, prescribed my psych meds and followed me from the hospital from there, to send something to them that said I was compliant with coming to all of my appointments. I was compliant with taking my medicine, which, of course, technically they're only going to know so in so much as the doctor says so and writes prescriptions. And, I would hope that if you have a mental illness, you're taking your medication. Now, once they had that in place, I was cleared for surgery. And that's how it was for me. I'm not saying that's how it's going to be for you. Everybody's journey is different. Everybody's physicians are different. Everybody's insurance is different. So that's, me, I have Medicare because I'm on disability related to permanent injury to my back. So that being said, the flip side of that is, so you have gastric bypass surgery. Well, something has to change immediately with your medicine. The first thing is you can't take anything that's like enteric-coated or delayed release or extended release, any of that anymore. And I'm going to insert one quick tip here also. You can get generic immediate release Tylenol capsules, and I highly recommend them because you'll get pain relief quicker. I have found that to be true. You'll find them in Walmart. Anyway, so I did have to switch around some of my medication and get to different forms of medicine. My dosages have lowered, and it kind of happened like this. I wasn't able to take as much as I had before because some of the smaller doses, some of the medicines that I was taking, I physically could not take the doses that were enough pills to make the dose I had been on, because those pills that were regular, that weren't enteric-coated or delayed release, sometimes come in smaller milligrams. So there's a little give and take there, but I'm on quite a bit less medicine than I was, and I'm doing quite well. Ask your surgeon and be real specific about this if they're going to give you your psych meds in the hospital. If they're not, and you feel it might create havoc in your world, then please make sure that they have something prescribed for you IV. If it's something for your mood that you need help with, if you need something for your nerves, there are good things that they can give you through the IV that will help with that. And for me, I had to have that. With regard to your medication, I know it might be difficult to figure out what's what and navigate that, especially if you're on psych meds. Sometimes you're on a lot of them. I would be absolutely happy to help any of you that want some help to figure out if there are non-delayed release and other alternatives to your medication that might need to be looked at before you have surgery. Always keep that in mind. It doesn't have to be psych meds. I'll talk to you about any of them. It doesn't bother me. A lot of years of nursing. So I'm pretty familiar with a lot of what's out there. That being said, I think that I've covered the whole mental health aspect And that was what my goal was to do today. I hope I've covered everything. I have a cat that's in heat that keeps making all these noises, and you guys probably hear her, but she's been driving me nuts for days, and she's very distracting. And as I said, I do have ADD, so it's not easy for me to get off course. If you have any other questions or you want help figuring out some of your meds, just put it in the comments and I will be happy to respond to you. Thanks. And wherever you are on your journey, I hope you're having a great day and I hope you're doing well. Thanks. Bye-bye.